So much for group A strep. Let's go to group B. So Streptococcus agalactiae. So take note that these are still beta hemolytic streptococci, okay? And they produce zones of hemolysis. So they hydrolyze sodium hippurate and produce a positive response in the CAMP test or CAMP test or Christie-Atkins-Munch-Peterson test. Contrary to group A strep, group B strep are bacitracin resistant, and they are actually part of the normal flora of the vagina and lower gastrointestinal tract in some women. But during pregnancy and childbirth, this bacteria can gain access to the amniotic fluid or colonize the newborn as it passes through the vaginal canal. Okay? Group B strep produce disease in around 2% of these events. If the baby gets infected during the first few days until around 1 month of life, infection can present as neonatal sepsis, meningitis, or respiratory distress syndrome. The baby will have fever, vomiting, and seizures. Sadly, around 20% will have long term brain damage. And the risk is even higher when factors are present that either decrease the baby's innate resistance, like, for example, prematurity, or increase the chances of transmission, like rupture of membranes for 18 hours or more before actual delivery. No? So, in cases like this, it is prudent for the physician to make sure to cover for these organisms before and after delivery. Actually, there are already guidelines and recommendations that OBGYNs follow, like screening of pregnant women even before delivery, and IV penicillin or ampicillin 4 hours prior to delivery for those with colonization, no? And who are in labor to prevent the colonization of the baby during delivery. And two more populations who are at high risk of infection are the elderly and those who are immunocompromised. For treatment, penicillin is still the drug of choice. Other pyogenic streptococci occasionally produce various respiratory, skin, wound, soft tissue, and genital infections, no? Which may resemble those caused by Group A and Group B strep. Although a few foodborne outbreaks of pharyngitis have been linked to Groups C and Group G strep, their role as a cause of everyday sore throats is not established. They often look like Group A strep on blood agar, and they are also beta hemolytic. They can be identified by using anti-sera specific for Group C and G, respectively. The Group D streptococci have undergone recent taxonomic changes. There are 8 species in this group, and many of these do not actually cause infections in humans. No? The most important is the Strep bovis group, which are classified to biotypes, no, following the old classification, but which is still used for epidemiological purposes, and the recent classification into 4 DNA clusters. One important species is Strep galliolyticus, subspecies galliolyticus under DNA cluster 2, no, which ferment mannitol and can cause endocarditis and is also associated with colon cancer. But actually, the taxonomists themselves seem to be confused, no? So we will not join them in the confusion, okay? It suffices us to know that they are non-hemolytic or technically gamma hemolytic and PYR negative. They grow in the presence of bile and they hydrolyze esculin, but they do not grow in 6.5% sodium chloride solution. They are also believed to be part of the normal enteric microbiota of humans and animals. Another important strep to know is the Streptococcus pneumoniae. No? These are also called pneumococci. They are a member of the Streptomyces group. These present as gram-positive diplococci, okay, or in pairs, which are lancet-shaped. But they can also be arranged in chains. They are alpha hemolytic and bile and optocin sensitive. Another important property for identification of strep pneumoniae is the quelling or swelling reaction of the capsule when mixed with an anti-serum. So they have a polysaccharide capsule, no, that allows typing with a specific anti-serum. The capsule is responsible for the virulence of the bacteria. It prevents or delays phagocytosis of host immune cells. Antibodies formed against the specific polysaccharides protects against infection. No? This is important to know because the pneumococcal vaccine developed for this purpose is now pushed as a part of the expanded program on immunization by the DOH, no, for children. So they are normal inhabitants of the upper respiratory tract, but they can cause pneumonia, sinusitis, otitis, bronchitis, bacteremia, meningitis, peritonitis, and other infections. Pneumococci have different types based on the capsular polysaccharide, no? Of which there are 91 types identified. In adults, types 1 through 8 are responsible for causing majority of pneumococcal pneumonia cases, no? And more than half of all deaths. In children, the most common are type 6, 14, 19, and 23. So it is the most common cause of community-acquired pneumonia or CAP. Now, we mentioned earlier that the bacteria are actually normal residents of the upper respiratory tract, di ba? Meaning the normal upper respiratory mucosa has natural resistance against the pneumococci. But infection happens when a number of factors lower this resistance. For example, damage of the mucosa due to a viral infection or damage due to hypersensitivity or allergic reactions, no? Causing abnormal accumulation of mucus or disturbance in the mucociliary physiology, or also depression of phagocytic activity in the area and depression of the cough reflex due to alcohol or drug intoxication. So this can cause aspiration of foreign material, okay, and also malnutrition. Pneumococcal pneumonia usually presents with fever, chills, and pleural pain. Sputum production is purulent with blood, no, or rusty colored sputum. On X-ray, consolidation may be seen on the right middle lobe and the left lower lobe. Pneumococci also frequently involves the sinuses, no, causing sinusitis, and the middle ear, causing otitis media, and even the triad of meningitis, endocarditis, and septic arthritis, which is a result of bacteremia from the pneumonia. Okay? Strep pneumoniae is the most common cause of otitis media and mastoiditis in children. And strep pneumoniae is also the most common cause of meningitis in adults. Now, complications can be prevented by early treatment. Strep pneumoniae are now more and more resistant to penicillin. That's why we cannot use it in low doses anymore. No? So, high dose penicillin G still appears to be effective, but the uncertainty has caused a shift toward third generation cephalosporins like ceftriaxone or cefotaxime. Patients with meningitis are usually treated with a high dose of an active third gen cephalosporin plus vancomycin. To be sure, susceptibility testing is performed. No, this is the best thing to do. Response to treatment is actually quite dramatic. No, there is reduction in fever, in the respiratory rate, and the cough in 12 to 24 hours after starting treatment. But the chest X-ray may return back to normal only after several weeks pa. For prevention, polyvalent vaccines are available for immunization. In the Philippines, the PCV13 is used. Now let's talk about the viridans group. So one textbook says that it comprises all alpha hemolytic streptococci that remain after the criteria for defining pyogenic streptococci and pneumococci have been applied, but they may also be non-hemolytic. Growth is not inhibited by optosine, and colonies are not soluble in bile. So this includes the strep mutans group, strep mitis, strep anginosus, strep salivarius, and the strep bovis group. Okay. Now, the viridan streptococci are the most prevalent members of the normal flora of the upper respiratory tract, no? And they are important for the healthy state of the mucous membranes there. They may reach the bloodstream due to trauma and become the main cause of endocarditis on abnormal heart valves. Some contribute also to the production of dental caries, no? Particularly the Streptococcus mutans. And lastly, the enterococci. Actually, these bacteria have the group D, group specific substance. No? That's why they were previously classified as group D, streptococci. They are usually non hemolytic and sometimes alpha hemolytic. They are PYR positive. They grow in the presence of bile and hydrolyzed esculin, and they grow well in 6.5% sodium chloride solution, no? Contrary to the other group D, strep. Enterococci are commensals and are part of the normal enteric microbiota. And the two most common species are Enterococcus faecalis and Enterococcus faecium. Infections are usually due to translocation of the bacteria, no, from their normal habitat. The most common is the urinary tract, no, usually due to instrumentation, insertion of urinary catheters, and structural abnormalities in the genitourinary tract. It can also cause meningitis and bacteremia in neonates, typically from vaginal delivery. Interestingly, enterococci are highly resistant to a number of antibiotics, no? To beta-lactams, cephalosporins, and aminoglycosides. No? Despite these, ampicillin is still the drug of choice for most UTIs and minor soft tissue infections. For more severe infections, particularly endocarditis, a combination of penicillin and an aminoglycoside is usually used. So again, susceptibility testing is key. So to summarize, streptococci can be classified according to their hemolytic reaction and their Lancefield antigen groups. Okay, so complete hemolysis and culture are found in beta hemolytic streptococci. If they are bacitracin sensitive or susceptible, they are group A. The bacitracin resistant groups that are CAMP factor positive are group B. Group C and G are CAMP factor negative strep that are also bacitracin resistant. For the alpha hemolytic strep and sometimes the non-hemolytic, the strep pneumoniae are optocin sensitive, and group D strep and the viridan strep are optocin resistant. All right.